Good afternoon. This is the House Appropriations Committee Health and Social Services Subcommittee. It is Monday, March 4th. Wow, that happened fast. Good afternoon, everyone. First, we're going to hear from the Maryland Health Benefit Exchange from our DLS analyst, Victoria Martinez. Victoria, as soon as you're settled, you may begin.
Thank you, Madam Chair and members of the committee. My name is Victoria Martinez. I'm with the Department of Legislative Services, and today I'll be presenting the Maryland Health Benefit Exchange analysis. The Maryland Health Benefit Exchange provides a marketplace for individuals and small businesses to access affordable or no-cost health coverage. As you can see on the first page of the analysis, the fiscal 2025 allowance increases by $34.9 million or 5.6% for a total of $658.2 million. As shown in Exhibit 1 on page 2, most of the agency's funding, 83%, goes towards reinsurance payments, while an additional 3% goes towards young adult subsidy program. The remainder of the budget is allocated towards the information technology and administration programs, with about 7% for each. Exhibit 2 on page 3 shows the breakdown of the IT and administration expenses, with the biggest IT expense being $15.3 million for maintenance and system support and $13.8 million for the Maryland Health Connection enhancements. The largest administrative expenses include $12.8 million for the call center, $10.6 million for personnel, and $10 million for connector entities. Exhibit 3 on page 4 shows the breakdown of the $34.9 million increase, with the largest changes being within the reinsurance program, with a $24 million increase for reinsurance payments and $10 million for the young adult subsidy program. Aside from the reinsurance program, there was limited overall change. There were various changes for IT independent contractors and other IT services, with the largest change being a $2.9 million increase for IT consultants to develop enhancements for the MHC website. Within the administration program, the largest change is a $3.2 million decrease in call center costs. In terms of personnel, as shown on page 6, there are 6 additional regular positions in the allowance for a total of 73 positions. The agency has a vacancy rate of 2.99%. and is below the number of positions needed to meet the budgeted turnover expectancy in fiscal 2025. The first key observation on page 7 discusses the reinsurance program and forecasted funding. The state reinsurance program was established in 2018 to address rising health insurance premiums in the state. MHB was required to apply for a state innovation waiver that would allow them to seek federal pass-through funding to support the program. The federal government approved the waiver in 2018, and MHB recently submitted a request for an extension of the waiver, which was approved, and the waiver period is valid from January 1st, 2024 through December 31st, 2028. Exhibit 4 on page 8 shows sample monthly premiums for a 40-year-old in a Care First Blue Choice plan, showing that the individual market rates for bronze and gold plans increased from fiscal 2023 to 2024, while the silver plan remains stable. Despite the increases from 2020 to 2024, sample monthly premiums for all 3 plans remain significantly lower than prior to the program's implementation in 2019. Exhibit 5 on page 9 shows the actual and estimated reinsurance costs and federal pass-through allotment from 2019 through 2028. In a previous projection, MHB indicated that the available federal funds plus the state reinsurance fee would have been insufficient to support the program through 2028. However, in an updated forecast, MHB does anticipate sufficient funding to support the program. The improved forecast is primarily due to lower than expected average reinsurance claim amounts, lower than expected program costs, and higher than expected federal funding. The second key observation on page 11 discusses the Young Adult Subsidy Program. Chapters 777 and 778 created the state-based Young Adult Health Insurance Subsidies Pilot Program for 2 years for 2022 and 2023. And chapters 256 and 257 extended the program through 2025. As shown in Exhibit 7, MHB experienced significant increases in all age group categories enrolled in a qualified health plan, with the biggest increases being 51.8% in the 18 through 25 age group and 21.7% in the under 18 age group. All other age group categories showed increases ranging from 10.7% to 17%. For comparison, the largest increase from 2022 to 2023 was a 7% increase in the under 18 age group. Key observation 3 on page 12 discusses the increase in enrollment in a qualified health plan through the Maryland Health Connection. As shown in Exhibit 8, MHBE saw a 17% increase in enrollment from 2023 to 2024, with a total of 213,895 in 2024. The red line shows the rate of uninsured Marylanders, which has been stable at 6%. And the last key observation, starting on page 13, discusses Medicaid unwinding and redetermination, which is one contributing factor to the significant growth in enrollment, as individuals that no longer qualify for Medicaid may seek a qualified health plan through MHBE. Beginning in April 2023, federal law required states to resume measures to verify eligibility information and allowed states to begin ending coverage for participants ineligible for Medicaid. There was a total of 161,659 participants up for renewal on December 31st, 2023. And Exhibit 9 on page 14 shows the outcome of these Medicaid redeterminations. Of these redeterminations, the majority, 60%, received coverage extensions, while 36% were disenrolled and 4% were pending reviews. Of the total coverage extensions, 85 were participants who were auto-renewed. And of the total disenrollments, the vast majority, 88%, were procedural terminations, which are participants disenrolled due to failure to submit a timely application or because the renewal was incomplete. So only 12% of disenrollments were participants who were disenrolled specifically due to ineligibility. Exhibit 10 on page 15 shows the number of individuals who enrolled in a qualified health plan who were previously enrolled in Medicaid, with a 375% increase from 2,966 individuals in 2023 to 14,089 individuals in 2024. And DLS asked that MHB discuss whether they anticipate additional growth in individuals enrolling in a qualified health plan due to Medicaid unwinding and other factors leading to high growth. Finally, page 16 discusses our recommendation, which is annual language requesting a report on the reinsurance program costs and forecast. And that concludes my presentation, and I'm happy to take any questions.
Thank you so much, Ms. Martinez, for the thoughtful and thorough analysis. Committee members, do we have any questions? Wonderful. Thank you so very much.
Thank you.
Next, we have the Executive Director, Ms. Everly. Oh, okay. I'm sorry. And Tony, Armiger. Thank you. I wanted to take an extra second as to not get your last name wrong. Whenever you're ready, thank you so very much.
Great. Thank you, and good afternoon, Vice Chair Jones and committee members. We are pleased to be here today to speak to the analysis of the Maryland Health Benefit Exchange and give you an update on some of our activities. So first, we want to thank Ms. Martinez for her very, as you said, very thorough and good report on the activities of the exchange and on our budget. And I'll start by just giving you an update of our current open enrollment. So we have just finished our 10th open enrollment. Amazing. We can't believe that we've been doing this now for 10 years. And it was our most successful open enrollment ever. As Ms. Martinez said, we had almost 214,000 Marylanders enroll in individual health coverage. And just to give you some idea of the strength of that, when carriers file their rates and we look at what the entire individual marketplace is, it's about 250,000. So now most of the people purchasing their health coverage are doing it through the exchange, that means the marketplace is doing exactly what it was meant to be, a place for people to come. They know where to come, look at all their rates, look at all their plans, find their best option, and get all the wraparound customer support we provide. What was most telling this year is all categories we had double-digit increases. Our new enrollments were up 64%, just phenomenal. And we attribute that to multiple things. Primarily, obviously, the Medicaid unwind, where we know people that were on Medicaid and now moving off of Medicaid is no longer eligible. Found relative affordable insurance in the individual marketplace. We also, at 10 years, we finally have become a known quantity. And that was demonstrated during the Medicaid unwind when there was a private firm that went out to see how do Medicaid people know where to get their coverage. And everyone resonated with, we get our coverage through Maryland Health Connection. So from a Medicaid perspective and a commercial perspective, people now know who we are. And finally, just our continued effort of targeted outreach, marketing efforts, our consumer assistance channels, whether it be navigators, our 2,000 insurance producers across the state, our call center that offers languages in over 200 different languages. They're all there to help. So we saw in our specific groups that we look at, of course, the young adult, that's one of our groups. We had a 41% increase in young adults between the age of 18 and 34. Now, why that's important is that it now is about a third of our entire risk pool makeup, which means we have a lot of young, healthy people, which helps keep those rates down. In our Black community, we had a 33% increase in enrollments. 46% of those were between that age 18 and 34. In our Hispanic community, we had 30% increase, and a whopping 50% were between age 18 and 34. So the specific outreach efforts and marketing efforts we have done are really paying off. One thing I do want to bring to your attention, and then I will address the question in here, is when you look at our budget, it looks like a humongous budget. And that's because of the reinsurance program. I like to really make everyone aware that that reinsurance program does not go to the exchange administrative costs at all. It is entirely a pass-through, other than about 20,000 that we, 20 or 60,000, between 20 and 60 that we use for actuarial studies. But the bulk of it goes right to the insurance carriers to pay for insurance claims to help keep the costs down for everyone. So although it looks like it's, millions, hundreds of millions of dollars, that's not going to the administration of the exchange. So just to address the question in here, in our analysis, we do anticipate we're going to have continued growth. The public health emergency unwind, the state of Maryland took the full 12 months to do the unwind program. We have about 3 months left of that. We've sent our first notices out for our May disenrollment, so we're coming down to the end of that. We're very fortunate in New Hampshire that we're one of 4 states that has what we call an integrated eligibility enrollment system. So somebody in Maryland comes to look for health insurance. Depending on your income, qualifications, we either route you through the Medicaid path or through the commercial path. We also have small business and vision and dental coverage. But that has helped us in the public health unwind to really make sure we're not losing people, we're keeping people enrolled. So we do expect that, again, the continued unwind, continued efforts of outreach and marketing, we hope to continue to see growth. And finally, I'll just close with, we know that the marketplaces, not only in Maryland but across the nation, have become a very important part of the health coverage continuum. And for many people, it's a safe place to be able to get coverage where previously they could not get coverage, whether it was pre-existing condition or it was too expensive. So it is part of that whole continuum now, and we're just thrilled and appreciative of the support that we get from our administration, from our legislators, to really continue to be able to do the work we're doing in Maryland. And just to wrap up, we do concur with the recommended action.
Thank you so much. And would that be all?
Tony is here with me. Tony Armiger, our CFO, is here to answer any questions.
Any questions? Wonderful, wonderful. Well, thank you so very much. Committee members, we'll go to questions now. Committee members, do we have any questions? Delegate McCaskill, I saw your light first.
Thank you, Madam Vice Chair. Good afternoon, everyone. Thank you for your presentation for the DLS analysis, and thank you for being here. Hello, my friend. So I do have a question for Appendix 2 on page 18. And I'm under Objects 03 for communications.
All right, I don't have page 18.
You have, is it, do I have 18, Appendix 2?
Appendix 2, got it.
Okay, so I'm at 3 for communications. Okay, thank you. And so I'm noticing that there is a big change for communication between FY 24 and 25 of 60.7%. Could you please explain the details about how you arrived with that deduction?
Oh, yeah.
Yes,
Please do.
Actually, what happened is this past year.
I'm sorry. Could we use the microphone so those watching later or at home can hear? Thank you so very much.
Sorry, thank you. This past year, we went on a telecommunication. We had Verizon, and we had phone lines. Basically, we had paying for Verizon, and this year we consolidated those costs and we reduced our costs for telecommunications. So basically, that's the real reason why.
Okay.
And
But
I'll just add a little bit to that. So every desk had a phone, a Verizon phone. When we went to, obviously, hybrid, first before that, when we were all home, we weren't using those phones. Then we went to hybrid. Some staff we got cell phones for, but then we went to Zoom phones because we all have computers. So we said, let's save the money from these desktops nobody's using, and you can see the significant savings. So we now use our computers for our phones.
Well, I think that calls for congratulations then. Well, congratulations to you. Okay, I just was concerned of whether there was some kind of change, whether, in service or exactly why that huge deduction had come. Thank you, I appreciate it. Thank you, Madam Vice Chair.
Great. Delegate Heinball.
Thank you, Madam Chair. Just a quick question on Appendix 2, which is on page 18, under Objects, line 04, Travel. It's not a tremendous amount of money, the increase, but it is, percentage-wise, it is a big increase, I think 167%. So I'm just curious, what's driving that change?
Is that in-state and out-of-state? So that is all of our in-state travel, out-of-state travel, so that includes conferences. Again, it has increased when we were in the pandemic, nobody was traveling, but now we're starting to do mileage and go out and do outreach, and so our in-state travel is increasing. And we've also strategically, in our strategic plan, we do a lot for staff development. So we don't have a lot of money. We have, 67 now, we'll have 73 FTEs, but we try, it equates about $400 per person, so we kind of accumulate that, and we'll send people to conferences where we can, usually in DC area because it's a little more affordable to do that. So that's why that has increased. That was a strategic decision to increase that.
So it's more a matter of getting back to where you were than an increase? All right. Thank you. Thank you, ma'am.
Thank you. So I do have some questions. First, let me start off by saying happy 10th birthday to the Maryland open enrollment. That is a very big deal, and it's hard to imagine that it's been 10 years, in all honesty. Just further proof, as my 13-year-old says, Mom, you're getting old. In a past life, when we were dreaming this up, it's just amazing that we're here. So I'm thrilled. So thank you so much. All right, so let's go to questions on page 8 of the analysis. Exhibit 4, it describes trends in sample premiums during the past 6 years for the Care First Blue Choice Plan. Bronze and gold plans have increased from year 23-24. They've been increasing at a faster rate than the silver plan. Can you comment on the approximate distribution of enrollment across the different tiers, and although each tier is different per provider, if there are similarities? Can you?
So I don't think we have the distribution by type in terms of enrollment, but we can certainly get that for you.
That would be great if we could follow up.
And I will state that every month on our website, marylandhb.com, we have a very comprehensive data report that lists all down to that level. And we also have a dashboard that we've sorted by your legislative district. So that's there. But anyhow, that's a side note. How we determine the rates, we have to follow the federal government gives us an actuarial value calculator, which means if it's in a bronze plan, 60 cents on the dollar is what the consumer would expect to pay, and the carrier would pay the other. I'm sorry, 60% the carrier, 40% the consumer. Silver, it's 70-30. Gold is an 80-20. However, in the silver, the way the plans are under the Affordable Care Act, there is a provision called cost share reduction. So that cost share reduction actually would bring for lower income people the value of that plan up to like 90% coverage by the carrier, 10% by the consumer. So all that to say that the rates are determined depending on how many people are on that plan, what the costs have been across for all the carriers' claims, and then when they file the rates with the Insurance Administration, they look at what is their cost going to be for that plan to provide that type of plan at that coverage level. Where does the reinsurance come in? And then they submit rates to the insurance department to be approved. So we have found, again, on bronze plans, those typically have very high deductibles. So we've seen, we've seen those prices increasing. We've seen gold increasing. Silver, because we have the cost share reduction and we have the enrollment in there, and those are very popular plans for use with credits, they've stayed about the same from year to year. I know it's very complicated and very confusing, and I don't know if there's anything else you want to add to that, but.
The only thing is okay. I mean, Michelle is right. Basically, if in the bronze plans, if they get a $1,000 medical bill, $400 the consumer will pay, $600 the carrier will pay. And so the silver plan, it's in the same situation. It's $700 the carrier will pay and $300 the consumer will pay. And that's why each plan is a little higher. The average bronze plan that is lower than the silver plan, and that's lower than the gold plan because the carrier is assuming more risk.
Okay, thank you. So can we go to page 13? First off, let me say how appreciative I am that we received your responses when we were. Sometimes we get them a little from other places a little later. So thank you so very much. It gave us the opportunity to really dig in over the weekend. So the DLS requests for more information about anticipated growth in individuals enrolling in qualified health plan due to Medicaid unwinding. So this is on the topic of Medicaid de-enrollment. I'd like to get a few more details about it. On page 13, the DLS analysis mentions that 12% of Medicaid disenrollments were due to the ineligibility and not procedural. Okay? That's roughly 7,000 Marylanders. So is that your anticipated growth due to Medicaid disenrollment, or are you projecting a different number? Are there any risks or anticipated burdens to the system as a result of the anticipated growth in individuals seeking a qualified health plan? Can you kind of take us through that, please?
I'd be happy to. So there were multiple, let me back up. When we ran what is called in Medicaid world a redetermination, in QHP world, commercial world, we call it a renewal. But in Medicaid world, it's called a redetermination. When we redetermine those folks, we run them through our system, and they run through all of the criteria that makes one eligible for Medicaid. If that person, if we don't have enough information to make them, to automatically renew them, the redetermination, and we're at about 63% of everyone, I'm going to just use the word renewal, that we renew in Medicaid is automatically renewed, meaning that we've got all the information, we ping the federal hub, we know what their income is, we know what their immigration status is, and we can auto-renew them, so there's no gap in coverage. So that's about 63%. And then there is a portion that we know, all right, their income as reported either through the state Beacon labor system, Department of Labor system, or the federal system, they're no longer eligible for Medicaid because their income is too high now. And so if we verify that, that's where we can automatically now put them into a commercial plan. So that's that, as you said, the 7,000 that we know are over scale, we can get them into a commercial plan. Now, they still have to come back and say, I want that plan, I'm going to make that payment if there is one. Then there's another group of people on here where we call, and those are the procedural terminations, where they may be eligible for Medicaid, but we can't confirm, most often it's their income. We can't confirm their income. So then we have to send them a document and say, we need you to return back to us what your income is, and we have to wait for that. Once we get that procedural or that information back, then we can re-enroll them, whether it's Medicaid or whether it's a commercial plan. Oftentimes what happens is that people don't realize they have to respond and send anything back, and it won't be till they go to fill a prescription and they're at the pharmacy and the pharmacy says you don't have any coverage, that then they'll send us what we need.
So is there anything that we can do differently or better between the not understanding? Is there another reach out that we can do to them in between?
Yeah.
We don't have enough information and I'm at the pharmacy and I only have one pill at home for my migraine medicine, for my prenatal vitamin, for my heart medication, my cholesterol. What's in between there that we can, another net where we can grab people?
Excellent question. During this whole redetermination phase, we've been doing multiple things. So we send out the notice, then the managed care organizations who have that person enrolled, they were doing a robocall outreach. Then we the exchange, were following that up 2 weeks later with another robocall outreach. We were throughout the process sending, because we know who they are, we were sending direct emails, we were sending, if we had their phone, text messages. So there's been an awful lot of outreach on social media to say, come on, you got to come back and take action, you have to take action. If someone has come in and tried to take action in the application and we see they've gotten stuck, we've actually built into our system where we call it, I think, the Chase campaign, where if we see you're in there but you haven't taken action or you all got halfway, then we're sending something out saying, oh, we see you filled out this information, but you didn't complete your application. Can we help you? Also, if they're in the application, we see they're stuck, we have built into that application our chat bot, which will immediately say, hey, we see you're, you need help. We're here. We've got a live person. We can connect you to a live person. So we've done everything that I shouldn't say everything. We've done many, many different variations of how we can reach out to people. But in reality, some people, especially if you're just surviving day by day, living life.
So, yeah.
You just, things get.
Well, I mean, I'm just kind of walking through my own experiences, other family members, right? So, I mean, if it had a deal, like if it was only like another touch with social media, you're not grabbing many members of my family. If it's text messages to a busy single parent, that's going to be difficult. So I'm happy to hear that it's several different avenues because, juggling is hard, right? Okay, I'm going to ask a follow-up, and then I am going to turn over the mic to my dear friend from Western Maryland. But are there others? Are there other steps the exchange can take in making sure that there's continuous coverage for the disenrollment of Medicaid? Is there any other?
The only other things we are doing is that there is, if you're disenrolled from Medicaid and you come back, you can get retro coverage. So you may not have, if you went to the doctor and you had to pay out of pocket, you can get that reimbursed, so you can have that retro. We also have special enrollment period for anyone coming who's losing Medicaid and coming into a commercial plan. So if it's after the normal time period to get enrolled in a QHP, we have a special enrollment, we can get anyone enrolled. So we're making it as easy as we can to make sure people don't have gaps in coverage and that we're having a continuation of care. And one other thing I'll note is that all of our commercial carriers participate in the Medicaid program. So that's good for continuity of care. If somebody's in Care First in the MCO, they can come over to Care First in the commercial market.
Okay, excellent. Billigan Heinball.
On page 4 of the analysis, thank you, Madam Chair. On page 4 of the analysis, it cites $2.9 million investment in IT consultants to make enhancements to the Maryland Health Connection website. I'm just curious, was that a strategy that was intended to offset the cost on the call center side, or is it because younger people are more likely to use the website? And I'm going to kind of mess this all together, and you can. I'm actually very surprised at the enrollment of younger people, because I was always led to believe that young people generally don't care about insurance. But you had some really big increases there in that youngest age group, and I'm curious, did they come in via the website, or how do you explain the increase in young people signing up? And then back to the other question, do you anticipate that the improvements to the website will offset the cost on the call centers?
Very good question. And I'll start with the young adults. It has been really a targeted effort of ours for several years to get more young adults in. So, I mean, working with community colleges, working with schools, putting things on apps that the young kids use that I don't even use, but really knowing like what that medium is that younger folks are going to. Having last year, not this year, but last year when and this was twofold, this was for our Hispanic community and young folks, during the World Cups of soccer, we had special commercials on at that time when we knew that population, Hispanic population, would be really focused on here, younger folks would be really focused on. So it's been an ongoing effort and a lot of just outreach to get the younger people enrolled. So that's kind of how we've done that. The marketplace, when you think of the marketplace, if you put us in two categories, I mean, we have policy, we have our, operations, but really what we do is all technology, right? Our marketplace is online portal. It's the mobile app. That's another way we've gotten young people on the mobile app. Everything we do is technology. Now, we're a little different at the exchange because many state agencies contract out with like Deloitte, Conduit, and they have these big fixed contracts, and they farm it out. We did that originally. And then we decided at about year 3 that we were going to pull all of our IT in-house, meaning that, as I said, we have, this is why, why we have asked for these additional positions, because we have 67 state PINs. The 6 additional PINs right now are going to give us another layer of management in our IT, because we have 150 not contractuals, contracted IT professionals. And what that allows us to do is hire people in different labor categories specific to what needs we are. If we need a mobile app developer, it requires a lot more time of our finance, of our procurement, of our staff to manage all that. But what it lets us do is be very cost effective, very nimble, and get the talent that we need for things that we need, such as, the mobile app, all of the chatbot. I'm trying to think of all we just introduced using limited artificial intelligence just for our chatbot. So we used everything on our website. It's limited, it's very contained. And the responses it gave are tremendous. We have been able to significantly reduce our call center contract because of things we've done in our system, such as the chatbot, being on the chatbot, getting to a live person, just improvements. We have people come in, and when they're applying for coverage, every open enrollment, we videotape them as they're going through so that we can see, where are you getting stuck? Is the language? Is it the system? So we're constantly evolving, and in fact, we've won 4 years in a row, it's called the CIO Award for innovation in our IT systems in government for what we've done. So that's where you see this money. We do it very different from anybody else, but it gives us a lot of flexibility to be creative, innovative, and save in other areas.
Yeah, thank you. One final question. Do you have a way of systemically reviewing all those initiatives, whether it's an app or a chat box or whatever, to see what's working and what isn't working?
Oh, we do. We are always doing that. And actually, I'll tie it back to, in our MFR, Managing for Results, we have in there a line item for our technical initiatives and what we're planning to do, so we track it as well. But yes, we're constantly looking. In fact, right now, our CIO is having his leadership team. He said, I want each of you to go through the application in the test environment and put in applications yourself, because you think of it from a technology standpoint, but you do it as if you're, put it in the test environment and go through it. And from there, he's challenged them to each come up with new ways to do it better.
Thank you. Thank you, Madam Chair.
Excellent. Thank you so much, and congratulations on your award. That's that's a big deal, but also multiple years in a row. And also, I just want to say thank you for all the different ways that you're thinking about reaching people where they are, right? Reaching people where they are so they know more. Delegate McCaskill.
Well, thank you, Madam Vice Chair. So it's kind of already been answered, but I too want to commend you all for all your innovative ways of reaching the user, and hopefully that's also making your lives just as easy on the administrative part. But I just want to confirm that I heard this correctly. So, and it's probably due to all the other innovative tech ways you have. But on page, I'm looking on page 9. No, I apologize, page 4. And I was reading that the largest change in the administrative program is I'm under budget, proposed budget change, the last sentence. The largest change in the administrative program is $3.2 million decrease in call center costs to assist in enrollment in health insurance product by phone. I'm just curious, is that also due to all of the other innovative ways that you have, that you're reaching users, maybe through enrollment? I'm just curious of that large decrease for the call center.
Yeah. A big chunk of that this year is because of the public health emergency unwind.
Okay.
We did get additional funding from the federal government because, again, we had all these, a million people that had to come back through the system. And so that's attributable to that public health emergency unwind. But if I might, I did want to just say, because I've been focused on technology, but not so much on the consumer assistance, but I do want to leave you with two things, how we partner with being where people are at in the community. We have a wonderful partnership with LiveChair, which goes into African-American barbershops and hair salons and helps particularly with Black men, helping them they'll take blood pressure tests, they'll help get them enrolled. So that's like our partnership. In Western Maryland, we have in Cumberland the Possibility Shop, which is not only get health insurance, but do you need a food box? Do you need help with finding a place to live? So I don't want to miss out on the in-person collaboration we do around the state to not only make sure people are getting health care, but we're being comprehensive as well.
So if I could, so it's not that you're finding that the call center is ineffective.
No.
It's been a collaborative of other efforts to
That's right.
get to, okay.
Right.
All right. Thank you, Madam Vice Chair.
And part of our strategy has been as well to get people connected with insurance producers because they're the experts, right? And they're paid by the insurance carriers, so there's no cost to the consumer. So once we get someone to an insurance producer, then year after year after year, they work with that insurance producer.
Perfect. Thank you. Appreciate it. Thank you.
Thank you, Delegate McCaskill. Any other questions? No? Well, I want to thank you so very much.
Thank you.
I appreciate you. Thank you, and have a
Thank
great
you.
day. Okay, next we will have DHS Child Support and our DLS analyst, Nathalie, when you are ready.
Thank you, Madam Chair. Good afternoon. My name is Natalia Andrade, and I'm here with the Department of Legislative Services to present the Fiscal 25 allowance for the Department of Human Services Child Support Administration. On the first page of this analysis, you can see that the Fiscal 25 budget increases by $5.4 million to $110.8 million. The Fiscal 25 allowance reflects a significant shift in fund sources. Federal funds increased by $15 million, which is coupled with a decrease of $10 million in special funds, mainly related to the Child Support Reinvestment Fund, not being budgeted in Fiscal 25. Exhibit 1 on page 3 shows the breakdown of the Fiscal 25 allowance, and as you can see, 57% of the budget goes to personnel, which is primarily to support the operation of local offices responsible for administering the child support services. 20% of the budget goes to the cooperative reimbursement agreements, and 7% goes to the Baltimore City privatization contract, which provides child support services in the Baltimore City through a private contract. Exhibit 2 on pages 4 and 5 shows the proposed budget change, and the principal factor influencing the 5.4 million increase between the fiscal 24 working appropriation and the fiscal 25 allowance is personal expenditures. As you can see, we have $3.2 million in salary increases and associated fringe benefits. And additionally, we have an increase of $2.6 million in the cooperative reimbursement agreement, which is attributed to higher salaries and cost of living adjustments for personnel involved in providing child support services under these agreements. On page 5 begins a discussion on the Child Support Reinvestment Fund. This is a special fund comprised of federal incentive payments allocated to states based on performance against 5 measures set by the U.S. Department of Health and Human Services. These 5 areas are establishment of child support orders, establishment of paternity, collection on current support due, collection on arrears, and cost effectiveness of state services. Exhibit 3 on page 6 shows the Child Support Reinvestment Fund expenditures. And as you can see, this fund has shown a steady growth in both revenues and expenditures over the past years. The governor's budget books estimate $18.4 million in revenue for fiscal 24, and the fiscal 24 working appropriation includes expenditures of $17.1 million. The fiscal 25 allowance does not include funding from this source, despite the department anticipating receipt of $10.9 million according to the governor's budget books. So DHS should comment on why no funds from the Child Support Reinvestment Fund are included in the fiscal 25 allowance. In addition, the Department of Legislative Services recommends reducing general and federal funds budgeted in the State Office of the Child Support Administration, which can be replaced by funds from the Child Support Reinvestment Fund. On page 7, in the personnel section, you can see that the vacancy rate as of December 23 was 7.8%, or 51.5 vacancies, of which 45.5 of them have been vacant for less than a year, and 6 positions have remained vacant for over a year. When we compare the number of vacancies as of December 22, the vacancies as of December 23 have decreased from 85.5 to 51.5 vacancies, indicating the concerted efforts of DHS to address the staffing needs and fill these positions. The 23 Joint Chairman's report requested that DHS submit a report on positions that had been vacant for over a year as of December 22. In this report, DHS indicated that by December 23, 7 out of 8 long-standing vacancies were filled. Additionally, as of October 23, the Child Support Administration filled 94 positions despite the 71 new vacancies, resulting in a net gain of 23 filled positions. DHS has initiated a recruitment and retention plan in December 22, altering minimum qualifications for child support specialist position to widen the candidate pool. On page 8, in the key observations section, begins a discussion on the child support performance. Exhibit 4 on page 8 shows that the statewide service performance for federal fiscal 23 remained relatively consistent in one of 4 performance measures, that is for cases with support orders, compared to the previous year. Performance declined in 3 areas, that is for paternity establishment, current support collection, and cases paying arrears. None of these performance metrics met the state goals for fiscal 23. These are represented by the red marks in the exhibit. Exhibit 5 on page 9 shows the state performance goals, but for the first quarter of the federal fiscal 24, that is October to December 23. And as you can see, while the child support orders nearly approached the target of 87.13%, performance concerning paternity establishment, current support collection, and cases with arrears all lagged behind the state fiscal 24 benchmarks. However, this is important to note that this data point is a cumulative measure that increases throughout the year and the first quarter data is expected to be low. Exhibit 6 on page 10 shows the collection of current and overdue support. And between federal fiscal 20 and federal fiscal 23, there was a decline in the total collection of current and overdue support, decreasing from 583 million in federal fiscal 20 to 458 million in federal fiscal 23. That's a reduction of 125 million. So DHS should discuss efforts that it is making to increase collections, particularly of current support owed. DLS also recommends adopting committee narrative requesting periodic reports on the Child Support Administration's performance against the federal incentive objectives and utilization of the new child support management system. The second issue is related to the child support management system, which is an application supporting the statewide child support business functions. While the intent of the new system is to facilitate administration processes, current challenges prevent the system from fully realizing its potential to support program integration. These challenges are related to system integration, limited information accessibility, duplication of individual reference numbers, which poses significant challenges for child support workers in assisting customers and addressing case concerns, and finally, difficulties accessing the MD Think portal. To conclude, on page 12, there is a list of the tasks that have been identified to be streamlined and made more efficient by the system. And also, there is a list of the priorities that will be addressed during the first quarter 2024. So DHS should provide an update on the status of these priorities and offer an estimated timeline for fully addressing these challenges. And with that, I conclude my presentation. I'm happy to answer any questions that you have.
Thank you so very much. Excellent analysis. Committee members, do we have any questions? No? Thank you so very much. Okay. Next, from the Child Support Agency and the department, Secretary Lopez, Principal Deputy Secretary White, Acting CFO Resnick, and do we also have Executive Director Kevin here? Yes, great. So whoever wants to begin, whenever you're ready, we are all ears. And let me also say big gold star too for sending us your reply early so we could dig in over the weekend. I so appreciate that. That's my new policy. I'm giving out gold stars.
There we go. We will take every gold star you are willing to give us.
When we get those responses in enough time to truly dig in, I'm handing out gold stars. So thank you so much.
Absolutely. Make sure I've got the right testimony because we've got two before you today. Good afternoon, Vice Chair Jones and honorable members of the committee. My name is Rafael Lopez, and I serve as the Secretary of the Department of Human Services. Joining me today to my right are Principal Deputy Secretary Cornita White, and to my left, Acting CFO Kirill Resnick. I'd like to thank the Governor and the Department of Budget and Management and the Budget Committees for their support, and all of the various staffs and analysts who have helped us put this budget together, including behind us a team from the Child Support Administration, also leadership from local departments of social service who are here to answer any questions if we need to. Our team at DHS empowers Marylanders to reach their full potential by providing preventative and supportive services, economic assistance, and meaningful connections for skill development and career opportunities. The Child Support Administration accounts for 2.7% of the department's $4.1 billion budget. We provide, through CSA, child support services to approximately 106,000 children in an active child support case. And this work helps make it possible for us to deliver on the long-term promise and vision of the Governor to end childhood poverty in Maryland. CSA works with both parents to provide the financial, medical, and emotional support that children need to grow and thrive. Child support and related services provide an opportunity for families to foster connections between the custodial parent, the child or children, and non-custodial parents that may not have otherwise occurred. CSA's investment in children's family connection and family economic security can break the cycle of poverty by helping parents raise children with a strong foundation. Last federal fiscal year, we collected and distributed over $400 million in child support payments benefiting Maryland's families. Of the amount collected and distributed, families previously participating in the Temporary Cash Assistance, or TCA program, took home $63 million last federal fiscal year, providing a base level of financial stability for children across the state. While this is a start, we can and must do more to make child support work for families, starting with improving our customer service and making sure MD Think works well. With that said, we'd like to focus on 3 areas this afternoon to highlight and bring to your attention, and the first is customer service. Governor Moore challenged each of our departments to dramatically reduce state vacancies, and we've done just that. Overall, for the department, we began in January 2023 with a 15.2% vacancy rate and ended the year on December 31st with a 9.7% vacancy rate, a reduction of 5.5% overall. And we focus those positions on customer-facing roles across the state in each of our 24 jurisdictions. For CSA specifically, we're pleased to share that since January of last year, we had a net increase of 43 new child support specialists and supervisors, reducing our program vacancy rate by nearly 10%, from 17.49% to 7.8%. Each day, we receive complaints from our customers across the state about the challenges they face while reaching out to us for help with their child support. Custodial parents often call local jurisdiction offices, the state office, or the call center simply to help them understand what is happening with the status of their child support payments. Non-custodial parents call us equally frustrated, about why their payment that they've made is not showing up in the system and why they can't understand what's going on. And that's simply unacceptable. We must get payments into bank accounts of custodial parents quicker and seamlessly. We must work more closely with non-custodial parents to make sure that they have clarity on how their payments are made, especially when there's challenges with them. And we'll talk more about that in a moment. The good news here is that we've been listening to the people we serve, responding with a new sense of urgency, and holding ourselves accountable for following through. We have challenged our team members and stressed the importance of treating the Marylanders we serve with greater respect and dignity. We're reminding each other to act with urgency to resolve these issues and to challenge the status quo all around us. We're working daily to improve customer service. This summer, we will launch a new statewide customer service call center that is far more responsive to our customers in real time. We intend to fully integrate the local departments of social services into a new customer service management system, or CRM, with world-class standards and accountability. These are just the baseline efforts that we must make to create the workplace culture where world-class customer service is the new normal for DHS. Marylanders deserve nothing less. Next, I'd like to turn your attention to our information system challenges, and specifically lifting up what is known as CSMS, or the Child Support Management System. This committee is now well aware of previous challenges around fiscal management, strategic and operational issues that we've come into course correcting this last year around MD Think. I'll not repeat all of those, but I want to focus on your attention on one issue related to CSMS, and it's specifically around the use of the application, both for our customers across the state and for all of our team members who use it every single day to do their jobs. The challenges with this have negatively impacted how Marylanders access basic services via the MD Think consumer portal. And we've seen a corresponding decline in key performance indicators in all of Maryland's jurisdictions, including Baltimore City, which, as you know, is privatized and operated by a privatized vendor. We're listening intently to our customers, and we're listening to our team members in every one of the 24 jurisdictions to make sure we respond in engaging them to creating better solutions, because they're closer to the challenges and they're generally closer to the solutions. Over the last 9 months, we have identified and prioritized system fixes with the Child Support Management System to ensure that this application works for our team members who use it every day. And we've improved the timeliness and accuracy of child support payment disbursements, which have sometimes literally disappeared. That simply can't continue that way anymore. We've hired a new Child Support Management System application director at MD Think and are thrilled to partner with him, his leadership, and the executive director, Pat McLaughlin, to continue these kinds of changes across the state. This work is just the beginning, and it's important that the public and our team members understand that we hear you and that we're moving with urgency to continue course correcting this. We'll also be hiring a director of systems modernization and information analysis to serve as a project manager for the Child Support Administration specifically, and that's something we haven't had in the past. This person will work closely with MD Think to fix and enhance the child support management system. Finally, we'd like to turn your attention to the kinds of changes we're making within CSA itself. We will be using the Child Support Reinvestment Fund as federally intended to expand programs and services for helping Marylanders. Maryland earns federal reinvestment fund dollars based on the program's performance on key metrics across our state. For far too long, DHS used the Child Support Reinvestment Fund to pay for CSA operational expenses. We will not be doing that moving forward. This administration will be data-driven and heart-led, and will use incentive funds to expand programs, increase access to outreach, and strengthen community partnerships via contracts with community-based organizations to make the Child Support Administration work for families, not the other way around. 9 months ago, we began seizing opportunities to strengthen these partnerships with key stakeholders, and will convene a new Child Support Advisory Committee with the Maryland Judicial Council, child support attorneys, and community-based organizations across the state to support families and expand outreach and strengthen Maryland's child support program. We understand that there's an enormous difference between parents who are unwilling to financially support their children and those who are unable to make child support payments. There really is an enormous distinction. So we are continuing to fund and enhance existing programs while actively seeking additional opportunities for new parenting and employment programs to assist non-custodial parents who need additional skills and employment opportunities to financially and emotionally support their children. We understand these barriers are sometimes of our own creation, and we're doing our best to try to turn them around, including how we'll strengthen our information systems and respond to what has previously been what we've known for around poor customer service. We're all better than that, and we take accountability and responsibility for that. And ultimately, it's a statewide effort. Not one single one of us can do this alone. We want to make sure children have the financial and emotional foundation to thrive in family and communities. And we want to make sure that we also invest in our team members to honor the hard work of our CSA members across the state, to respond to their challenges, to respond to their frustration of these long-standing issues, and make sure that we are designing the right course corrections across the state. With that said, we thank you for your partnership in assembling this budget. And now I'll turn it over to our Acting Chief Financial Officer, Carol Resnick, who will respond to the DLS questions and analysis.
Thank you, Mr. Secretary. Thank you to the subcommittee. There are several questions I will be responding to, of which the detail is in your testimony submitted. I will hit the high points. To question number one, asking DHS to comment as to why no funds were included in the fiscal 25 allowance for the child support reinvestment funds, and to the recommendation that we reduce general and federal funds and replace it with the reinvestment funds. Previously employed DHS budget staff inadvertently left off child support reinvestment funding as a funding appropriation in the budget submission. We will work with the Department of Budget and Management as well as the Department of Legislative Services to correct this oversight when we are informed by ACF of the annual allocation in the coming months. However, we do respectfully disagree on the request to reduce general and federal funds budgeted for CSA and replace those funds with the reinvestment fund dollars. We believe this is contrary to the federal purposes of the investment fund and intend to use those investment incentive funds as explained by the Secretary in his testimony. To question two, asking us to discuss efforts to make in increasing collections, particularly with current support owed. DHS concurs with the recommendation to provide an additional report and will provide periodic reports as requested. The department seeks to increase collections, particularly current support, through several methodologies. First, by building and renewing trust. Second, by increasing strategic partnerships. And third, by improving the child support management system within MD Think. Details for how we are implementing these efforts are laid out for you in our written testimony. To question three, asking us to provide an update on the status of the priorities mentioned and offer an estimated timeline to fully address the challenges. Priorities addressed during the first quarter of 2024 are expected to be completed by the end of March, while any additional work identified during development may occur during the second quarter. We've included the details of those updates to our first quarter priorities in the written testimony, and they include data reconciliation between the three main applications of MD Think, payment summary and visibility in CSMS, and modifications for support orders in CSMS, as well as additional fixes. As to the two recommendations, the first one addressing the reduction of general and federal funds and swapping them for the reinvestment fund. Again, as stated, we strongly disagree with that recommendation, as we do not believe that the investment fund is allowed to be used for operational purposes. And second, to the request to provide a narrative for child support performance reports. We happily concur and will provide those reports. And with that, thank you all very much. Happy to take any questions, and we ask you to support the governor's allowance.
Thank you so very much. I appreciate it, and let me be clear that I'm appreciative for what the department has inherited, what you have been able to do, and so far the time that you have been given. And so I'm extraordinarily thankful. Also for your clarity, your honesty, and your transparency, which consistently DHS has been. So I will allow others. I don't want to completely hog. Okay. Delegate Heinbaugh, I do have lots of questions, but I'm going to yield to my colleagues. Sure. Delegate Heinbaugh.
Thank you for being here, and thanks for all you're doing. I appreciate it. I'll start off with a real easy question. Hers will be much more difficult.
Sure.
On page 16 of the DLS analysis, under I think it's line 04, I believe, travel. The travel budget just about triples. I'm just curious what's driving that.
Good afternoon. I'm Kevin Geisweit, Executive Director for the Child Support Administration. What happened in the last couple of years of the pandemic, our travel budget was cut for child support. And as we need to get back out to audit our counties to ensure that things are being done properly through various different audits and other visits to county offices, we need to increase that travel over the next year or so. And that's the impetus for the increase in travel. Is
that travel mostly for people from the office of headquarters to go to the field, or people that are out in the field to go visit?
It's for our headquarters staff to go out to visit. Yeah, we have different corporate reimbursement agreements we have to monitor, and we have to do on-site visits for some of those according to federal regulations and state.
So you haven't been doing that the last...
Right, for the last 2 years, we have not done that.
Okay, thank you.
Yeah.
Thank you, Madam Chair.
Delegate McCaskill.
Thank you, Madam Vice Chair. I don't know if it was a good idea for you to yield to us because I have just as many questions.
Wonderful.
But it's just to help me just decipher the agency a little bit better. Probably, I must admit, not until I got on HSS that I really had the chance to really figure out the flow chart, and then my brain got misconstrued again with other questions. I guess from a child care point of view, being in the industry for the past 25 years, I've always viewed child support as the jailed system, if you will, for families, right? Families not able to move for those who are waiting to receive, and families who may be caught up in the system. So I just want to applaud you for the reform, if you will, that's going on within the system, because I have had a lot of families that asked me if I could help them to navigate through the system itself, and I was always lost. So I'm grateful to be at this point right here. So 2 things. This one is a quick one because my next one, I have to just follow me as I go. Sure. But I'm referring to page, under personnel data, page 7. So I see that as of December 31st last year, that there were 51 and a half vacant positions and 45 and a half of them vacant for less than a year, while 6 positions have remained vacant for over a year. So my question on that is, what are the roles and is there a special effort being taken to ensure that the roles are fulfilled for those vacancies that are still standing?
Sure. I'm going to ask Kevin to answer the one specifically for CSA, then I'm going to tie it to a department-wide effort on this exact issue.
Perfect.
In terms of a lot of our vacancies, they are often within the child support specialist series, so our child support special workers. And a lot of times, a lot of our vacancies in child support, too, are because they're leaving from one county to another county. And so it leaves a vacancy that we have to then fill in a different county. So we share a lot of that staff around in that area. We also lose staff to Washington, D.C. and Northern Virginia sometimes, especially in the Prince George's County and Montgomery metro offices. But we make those efforts, of course, to keep filling those immediately and do all we can to keep recruiting to fill our child support positions. Does that answer the question you had?
Yes, that's good.
And if I could build on that to answer Delegate McCaskill, there's also a real serious hard look that we're doing across the department to incentivize and try to keep as many people who want to join us as an employer of choice. So for example, Department of Human Services has had the discretion to hire at higher base levels, which we have done systematically this last year. That's within current regulations, right? Now that said, that increases the total amount of dollars that we're spending. So that's one thing we're doing to be proactive, to look for more people and then also direct them in customer service positions like the one Kevin just mentioned. Secondarily, we're also taking a look at what are the patterns and practices of vacancies that we've had for more than 1 year across the entire department. Where can we strengthen job descriptions that unilaterally can be, if you will, the bench of talent for all of our administrations, for all of our work, so that we could actually reimagine how we're recruiting from our own bench of talent across the state. That's something we haven't done before. So rather than saying the CSA job description is like this and it pays X dollars, and then SSA or the FIA are completely different, imagining that many of them require base level skills. Why wouldn't we invest in our people and imagine growing our own in a very different way? That's ruffled some feathers because, as you can imagine, some of those roles that have been vacant for a year, there's different arguments across all 24 jurisdictions. We're trying to listen very carefully about what those are and then both reimagine them, reposition them, and then articulate a different way to recruit for them. So that's how we're seeing both this response in CSA, but also statewide.
Okay, perfect. Okay, I do have another question, if I could dig. Okay, so I had to write myself some notes.
Sure.
You know I love the red pen so I can understand, but follow me on
Sure.
this. So under child support determination for SNAP eligibility. So under COMAR 0703-1713, child support and alimony are included in the calculation of income for SNAP eligibility. This is kind of like my equation. I need you all to help me with. All right. As we know, child support paid under a child support order is an allowable deduction in the calculation of SNAP eligibility. Am I going good with this so far?
We hear you.
Okay, perfect. We understand that DHS only considers the actual child support received in its calculations for SNAP eligibility and benefit calculation, and that the federal rules require calculating child support payments as income. But could you explain in more detail about how this works in practice?
Sure. And I'm going to approach it from a slightly different angle, though,
Okay.
because I think that this is actually something that has been the source of great frustration, I think is probably the nice way to say it. The way in which our department has approached anti-poverty programs writ large for the state needs a significant transformation. Child support, the way in which income is calculated in this state is something that we're taking a really hard look at. It took many years to get here, and it's going to take a few more to untangle this. We couldn't possibly untangle all of this in one budget year. Why I'm starting there, Delegate, is because ultimately what I'd like to move us all, the entire state, to do is rather than look at the slice of pie as limited and so little for people who need our help the most, I'd like to imagine for a moment that we're investing in families that are struggling in a dramatically different way, leveraging every federal opportunity to actually expand the way we think about policy and practice and how we serve people who are struggling in the state. So on the nuances of how we calculate our what is called income, it's a matter of transferring dollars and cents across our budget. That's the quickest way to think about it. And it is a policy decision that this state has made via the Department of Human Services prior to our arrival. I'd be remiss if I said I could change that overnight, or we can change that overnight as a team. Some things we simply cannot, because there isn't all of the source of revenue to do those. So very simply, when, for example, we are calculating, let's say, temporary cash assistance as funded by the federal government to us, and how we pass through payments to child support, the money's got to come from somewhere. And that somewhere would be the general fund, for example. And so in order to make those kinds of policy changes moving forward, we are taking a very close look at how to expand and reimagine all this work, and to come back to this body and the governor with a set of options as part of a much larger strategy to end childhood poverty. As you said earlier on, some of the thinking in this state around child support is quite antiquated, to be frank. And it has been seen and perceived by many of the people as the government, if you will, doubly punishing people. And I don't know how else to put it. And the complaints we receive and the conversations I've personally had, the Principal Deputy Secretary has personally had, our Executive Director of the Child Support Administration, remind us of just how much work we have to do. So rather than on the record right now walking you through the nuances of exactly how that money is transferred, I'd much rather prepare for you some options for consideration moving forward into the future, because I think that's the kind of conversation we need to have in the state around true anti-poverty reduction measures that really are going to challenge how DHS has looked at this work, not just for 1 year, not just for a few years, but for well over a decade. One could argue that Maryland has to catch up with some of the more innovative thinking that some other states have done across the country around how we look at the families we're serving in child support, not as simply broken to be fixed, but as also full of power and potential and promise themselves. And how we treat them and engage them matters. To give you one concrete final example to your question, we have learned that the way in which we've handled arrearages has left us open to severe criticism. And what we've learned as a team is that the folks who criticize us are right. Rather than saying, I'm going to punish, I'm looking at your first name informally, Miss McCaskill, who might be the non-custodial parent paying, for Miss Jones's children, and rather going after you, why aren't we actually having a regular conversation with you? What is it that's challenged you around making those payments? Did you know, for example, that the Child Support Administration, under the jurisdiction and authority of the Department of Human Services, can grant different ways of reimagining your arrearages? Why aren't we using, for example, the federal investment support funds to actually pay for community-based, community organization, community-centered services to help Ms. McCaskill skill her up and make sure she can actually make the payments to Ms. Jones and her children? All those examples I've just given you, we've actually not been able to do because we haven't used, for example, the federal reinvestment funds to do just that. So on these issues that we're finding, they are all, from our perspective, issues of actually truly addressing poverty in this state in a very different way and not punishing people who are struggling to make ends meet. That's where we want to move this department. And I wish we had a magic wand to move even faster than we're trying to move right now.
Thank you for your candor. I just want to ask two questions, just out of curiosity.
Sure.
I know we're thinking of moving forward and how the agency is going to move forward and helping our families, and not instead of dissecting it right here. But I'm just curious, when an applicant applies, and do they? Two specific questions I want to ask. Does a single parent seeking eligibility have to establish who the non-custodial parent is? Is that part of the process of establishing who it is? Okay.
The quick answer is yes. And Kevin, do you want to give a little bit of context? That's actually really important. There's some federal rules around that. Either of you, please feel free.
Okay.
Just to clarify, are you saying when they're applying for SNAP?
Yes. I should have been more specific. Yes.
So, quick answer is yes.
Okay. Okay. And then does the parent who needs to provide things like estimated dates and locations, home or work addresses of the other parent, is that part of the process too? They have to prove the residency of the other parent?
Well, they have to give us information that they have available. If not, we have locate services to try to find the other parent if they do not know where they are.
Okay, and so the single or the custodial parent are not signing their right away, are not signing away their right to child support payment to the state, right? Are they?
For temporary cash assistance, there is federal regulations where they have to sign their rights to support. And what they do is that basically they get a support order that does reimburse the state and the federal government for temporary cash assistance, but not for SNAP, if that's your question.
Okay. So I guess we can do this offline because you see how it needs a kind of a dissection of helping me understand this, the whole process. So I guess I'm curious about what the paperwork looks like for the families, like when they apply and what they're, from beginning to end, to kind of help me understand,
Happy to.
detangle some of this mystery, if
Then
you
let me
will.
give you a very quick response on what I think ultimately the heart of your question is around the establishment of paternity in many cases. So this is long held in federal law, and the Child Support Administration isn't the only one that struggles with this, right? Any state does. This is not a Maryland-specific issue. Why that matters to Kevin's response is because there are very specific federal rules and laws that require states who choose to actually draw down federal money to follow those rules. If, for example, Kevin said, we don't want to do that anymore, that would essentially say Maryland wants an exemption from something, and the federal government could say, we're not going to give you any federal money for that. That would be as basic as it gets. So the question is a quid pro quo. If Maryland wants to receive money from the federal government, from the Administration for Children and Families, specifically the part of it that gives that Child Support Administration funding for us, we have to follow those rules, number one. Number two, on the issue of how we creatively and innovatively try to break down the long-held mistrust of government, which is ultimately what we're talking about, right? We mistrust the government on issues like sharing information about the location of a non-custodial parent. Sometimes we might choose to not give that for any number of legitimate reasons, right? And long-held evidence of history of the way in which governments have misused that information. But that said, trying to turn that around. To give you a concrete example, Kevin, myself, the Assistant Secretary of Policy sat down with Joe Jones, the CEO of the Center for Urban Families in Baltimore City. Baltimore City, given its population in terms of the numbers, has a large number of cases in the city that reflect very similar patterns across the state. That conversation with his staff led to, for example, a partnership between CSA, Baltimore City, to have a singular person representing Child Support Administration be at their office once a week to rapidly prototype the idea of how to increase trust, break down the silos around things like arrearages. That person is in the community outside of a government building, building the trust and engaging people from the trust that he and his staff have built. We just did that a month ago, 2 months ago? Right, so that just started to the point of how do we help increase trust so we can really support the family in a very different way, because asking these exact questions. What do I have to give to you and why? When do I have to give it? Will I be penalized if I tell you these things? How much will my income help or hurt? What other benefits I can receive? That's going to take some time to turn that culture, but we'd be happy to respond to you, Delegate, with perhaps a very simple copy of the kinds of questions we ask. Many of those, as I said, are federally designated, but we also need to strengthen how we customize them to make sure they're Maryland proud and Maryland centered.
Thank you. I appreciate that response. I guess maybe one day you could, if you have to, you can drag me by the hand and just like
I was going to say we could have
take me
Kevin and his
take
team
me
come
in
with us.
and just say, okay, Delegate, I'm a visual person and I can see it better, but I'm just trying to dissect some of what I hear in the communities. And
So maybe we can schedule a time and have Kevin and his team come and sit down and kind of walk through your
That
question
101
one by
for me.
one and do a one-on-one kind of learning session.
thank
with
you. I appreciate it. I'll take you up
Or
on
in
it.
your local jurisdiction child
Or in
support
your
office.
local- yeah.
I mean, I think that
Thank
would be
you.
better for
Yeah.
any delegate who wants to do that. We are happy to do
Well,
that.
look at there. I have opened up the
happy to.
window.
Absolutely, because I would love the same thing, but by the same token, we have the room for the rest of the afternoon. So we can do this.
We do have OHEP hearing as well with you.
I won't do that.
Got the room.
Right. I think, though, to your point, though, Vice Chair, this is about leading in a new way. It's governing in a new way. And it's breaking down the silos that have heretofore been about a narrative that is about the brokenness of families and the brokenness
Yes.
of parents, not about their strength or their assets. And let me be clear, there are people who take advantage of our system. That is not the preponderance of people in the state of
No,
Maryland
it's not.
or preponderance of the people in this country.
Absolutely. And I appreciate that. Thank you very much. I do have questions.
Sure,
And
jump in.
quite a bit. So I have a few follow-ups. The executive director, is it Gustwit? Gustwit. You had said that we were losing folks, not just from jurisdiction to jurisdiction earlier when we were speaking about vacancies. You also said that we would lose, you would lose folks to the District of Columbia or Virginia. Was that correct, sir?
That's correct. And the federal government as well in D.C.
Could you give us the reason for which we would lose people from Maryland to go to the District of Columbia, the federal government, and/or the state of Virginia?
Sure. Things that we hear a lot is that they offer more money for their positions. Oh, can you hear me? They offer more salary for their positions, and other opportunities in terms of like whether they prefer to work in those areas. That's what at least feedback I've gotten from those.
So salary was
Mostly
mostly salary was listed.
Exactly.
Thank you. Secretary Lopez, I heard something in your opening remarks that moving with urgency, because that is so critical at the end of the day. Who we're talking about and who needs us, and why we are serving is also, I feel, walks parallel with the sense of urgency. So let's dig into all of my questions, please. So you had mentioned several times federal law. Let's recognize that federal law recipients of cash assistance, TCA, right, to assign child support rights to the state, and that the state must distribute a portion of child support that it collects to the federal government. So we're really talking about child support pass-through policy. Could you explain the waiver policy that allows Maryland to pass through the first $100 of child support collected in a month for one child, $200 of child support for two or more children? And like specifically, since Maryland's current pass-through policy just took effect about five years ago, what can we do to ensure that the state's more populous jurisdictions, which account for 70% of TCA caseload, have higher pass-through rates?
Sure. I'm going to take a first jump at this, and then I'm going to have Kevin provide additional detail. And I'm going to share with everybody one of the questions recently got asked, which actually I think highlights how this works. And then we'll go into even more granularity. So first of all, the pass-through amount in general is derived from the current monthly child support payment made by the paying parent. The pass-through amount does not include payments made towards arrears. A temporary cash assistance, or TCA, participant is federally required to assign their rights to child support to the state while receiving assistance. That is a federal rule, not one that we've made up ourselves as the state of Maryland. Federal law requires states to retain child support collected on behalf of families currently participating in the TCA program. Retained child support is divided between the state and the federal government as reimbursement for the assistance paid to the family. Maryland may choose not to retain child support and quote-unquote pass through, your point, pass through the full child support payment to the family. Maryland currently limits the amount of child support collected by the state that can be passed through to families to monthly allocations of $100 for a family with one child or $200 for a family with two or more children. Federal regulation establishes child support distribution rules. Again, those aren't ones we choose ourselves. Obligations for current support are satisfied before payments are applied to arrears. So I wanted to give the framing of the sort of the policy that we're currently following in Maryland based on current federal rules. And then Kevin, if you want to add any additional detail to the delegates' questions, please feel free to do so.
Sure. And just from a historical perspective, there was a federal law that came out in 2000. Sorry, let's get the microphone closer.
Yep, there we go.
Is that better? All right. From a historical perspective, there was a federal law that was passed back in 2005 called the Deficit Reduction Act of 2005 that actually set this in motion in terms of what states could do. The choice of the $100 and $200 is that the federal government forgives up to that amount then for what is owed back to them. Anything additional to that, the state would have to pay to increase the support pass-through further. And that's why the decision was made by most states to just stick with the $100 and $200 as current. And what Maryland did a few years ago, Maryland was, didn't come into this as fast as some other states did. Having, again, I think it was 2016, I think it passed, and it went into effect, I think, in 2019 for this legislation. I hope that helps answer your question a little bit with some background.
It does. So has the state's partial pass-through child support policy led to any improvement in outcomes? So, i.e. payments received?
I have to look back at the studies again. Our University of Maryland partners have done some studies on this, and I know it does show some improvement. And I know the historical research shows that the increasing pass-through will help increase the collections earned, and because a non-custodial parent feels better knowing that their money is going to the family versus going to the state to reimburse.
Okay.
And on that note, Vice Chairwoman, this nationally, from the research I've done previous to this role, is a trend nationally. We're seeing a decrease in collections writ large across the country. There's different schools of thought as to why this is happening. I would offer you, as your secretary, that one of the perspectives that I've leaned on is the increasing distrust of government across all of our demographics in this country. And part of that has to do with, to Kevin's point, if I have the option to give $50 to Kevin at CSA, of which he's only passing through a dollar amount, I might say, what's the point? I'm breaking my back to do this work. They're only going to give a piece of it. I'm not going to do it. No judgment made on the parent's choice. That's just what we're seeing across the country. So Maryland isn't the only state struggling with this issue, which goes back to the earlier comments, both in the response to Delegate McCaskill's questions and the testimony, both written and oral, which is to increase our community-based, community-trusted partnerships so that they can help us on our behalf where people already have trust and respect and credibility. I think that's one of the only ways moving forward that we'll be able to, as a state and as a nation, increase the trust so people feel that their hard-earned dollars are going to the right place, and in this case, their own children.
Well, and I appreciate you, to be clear, whether it's your written testimony or other testimony that you have given, I just, in some cases, do want to drill down a little bit more so we make sure to have everything.
Absolutely.
So you brought up other states, which is another one of my questions. So would you say that it's accurate to say that if Maryland were to follow Colorado, Minnesota, other states, and require full pass-through, that the state general fund expenses would increase to compensate the federal government for its half of the child support collections? So like if in FY23, with collections retained by the state totaling $12.3 million, general fund expenses would have increased by $6.1 million to reimburse the federal governments for its share.
The quick answer is yes, because the money has to come from somewhere, right? So so let me back up to there's a policy decision here. The policy choice is that the state of Maryland wants to model what other states have done across the country. They've chosen to choose, in most instances from my national reading, and Kevin will correct me if I'm wrong, I'm happy to be wrong if I am, they've chosen to use state general fund dollars to make up that difference.
That's true.
Okay. So,
No, go ahead.
yeah, go ahead.
I would say that there's several steps in that choice. We can choose to cover the portion that Maryland keeps, right, which is half that amount, or we can choose to cover the full portion of pass-through and reimburse the federal government out of our own state dollars, which is double that amount. But there are steps involved in that policy choice as to what we may want to do, or more clearly what we can do given budget realities.
Okay. Thank you very much for your answer on that. Okay, child support, let's see. I have a question on performance benchmarks, 2024 progress. On page 9 of the analysis, mentions that the department is lagging in all metrics across the first quarter for child support orders, cases paying arrears, paternity establishment, and current support collections. It's a cumulative measure throughout the year, so the data might be low here or is expected to be low, but they serve as leading indicators for the rest of the year. Could you comment maybe on whether these metrics are where they should be at this point in the year, or will they hit the year-end metrics?
I'll start. These are all based on the federal fiscal year, so it is an accumulative measure that our final numbers obviously don't come out until the final end of the year, so October to September. These numbers are currently in approximately where they usually are about this time of year, where we are in terms of performance.
Okay, so this is normally that they're in arrears right now, and they will course correct throughout the year?
Yeah, arrears is always very low because it's a cumulative number.
Okay.
But that number usually comes out very close to our goal, if not meeting our goal in most years.
Great. So you definitely had detailed testimony outlining the lack of trust. We've talked about it several times, systematic issues that have led to a decrease in caseloads and thus overall a lower amount of collection for child support. But could you please provide more detail on what is being done to improve if there's anything else you want to say, I want to give the opportunity to what is being done to improve collections for the cases where funds are owed. I just want to make sure that we have everything on the record for that, that we want to talk about. And is CSMS improvements sufficient alone for collecting more of what is currently owed to families? Specifically, I was looking at page 10 of the DLS analysis.
So let me start with your last question first, because
Okay.
I think it actually frames the whole thing. And then
Okay,
again,
great.
Kevin, if there's anything I missed, please feel free to jump in. The challenges we've encountered as a team across the state in all 24 jurisdictions on CSMS cannot be understated.
Right.
So that's the application. So it's the application that was built to replace the legacy system that's now on the MDThink platform.
Right.
Our team has visited every single jurisdiction multiple times. When staff are showing us and walking us through some of the challenges they face, it is daunting because some of these things are both technical and operational and technological, but oftentimes cause different or disparate data values on how much, when it was collected, et cetera, the basic fundamentals of running your child support system. So part of the work that we're doing with MDThink, which you lifted up, and the new director of CSMS, is to literally engage our teams across the state. We've had, I don't know how many active town halls across the state on this, small conversations to dive into why these problems have persisted since it was launched. One could argue, and I feel comfortable saying this on the record, that when CSMS was launched, it wasn't ready to launch. So part of the challenge and struggle of our CSA team is to constantly question themselves, is this the right data that I'm receiving? Is this the right information? To the team's credit, across CSA and in partnership with MDThink, they're making progress. Again, not as fast as we'd like, but genuine progress. And part of that is figuring that out. Now, that's why I started there, because the data that we're seeing, the patterns that you're asking about, sometimes we question it ourselves around, is this typical of what's happening year to year, to your question of where you see these numbers, right. But also around the issue of the consumers being able to look at, the customers being able to look in the consumer portal and find out where things stand for their own cases. Staff have lifted up to us across the state that there's often a disconnect. So we're trying to understand where those problems are and to fix them. Kevin, in his role, and all the executive directors of the administrations, in addition to senior leadership of DHS, have a weekly Wednesday call at 5 p.m. with MDThink to go over these exact issues. What are the patterns and practice that we're finding across the state to try to tackle them? And to be frank, part of it is the frustration of trying to course correct some decisions on the operational front and technological front, which we're making progress and we're prioritizing those, Vice Chairwoman. But again, there are so many fixes that we have to make that we simply can't do them all at once. Right. The hope is the continued operational and technical fixes will streamline the way our own team members are experiencing tapping into the data to give more accurate and have more trust even in the data. Kevin, is there anything I missed there?
No, you covered it.
Okay. I think I answered both your questions, but if I didn't, please say so.
No,
Okay.
I appreciate that. And that concludes all of my questions. I just wanted to make sure that you, anything else? No. Members? Everybody's okay? Okay, excellent. So that concludes the hearing for, and thank you so very much for the unbelievable amount of work and the heaviness for which this issue entails, as well as all that you're doing. So I think what we're going to do is that concludes the DHS Child Support Administration. Is it currently 2:42? We are taking a 5-minute recess, as sitting is the new smoking. So we will begin again at 2:47.
Wonderful.
For DHS Office of Home Energy Programs. Okay. I hope that everyone was able to stand up and move a little bit. Thank you so much. Our recess has concluded. Now we're going to move on to DHS Office of Home Energy Programs. We're going to hear from our DLS analyst, Samuel Quist.
All right, thank you. Thank you, Delegate Jones. Samuel Quist from DLS for the Department of Human Services Office of Home Energy Programs. The budget has a $14.5 million decrease, or 6.7%, to $200.9 million. In the interest of time, I'm going to turn ahead to page 9 of the analysis, which shows the overview of fiscal 2025 spending. You can see about 91% of the budget is for energy assistant benefits. The Maryland Energy Assistance Program totals $58.6 million. This program is primarily federally funded through the Federal Low-Income Home Energy Assistance Program. This program covers both bill payment assistance for home heating bills as well as arrearage assistance for natural gas, as well as a portion goes to the Department of Housing and Community Development to fund weatherization assistance. The Electric Universal Service Program provides bill payment and arrearage assistance for electric bills. This is funded through special funds, a combination of the USP ratepayer surcharge and electric bills, which totals about $30.6 million, and the Strategic Energy Investment Fund, which totals $94.1 million. Turning to the proposed budget changes on page 10 and 11, under the energy assistance benefit category, the largest areas of decrease in funding includes about there's a $10.3 million decrease in federal funds from the Low-Income Home Energy Assistance Program budgeted for energy assistance. This is due to changes in the availability of federal funds for the state of Maryland under this program. In fiscal 2024 and prior years, there was some additional supplemental federal funding available. There's a $5 million decrease in SEEF special funds allocated to energy assistance. There's also a $3.6 million federal fund decrease from the Low-Income Water Assistance Program. Between fiscal 2022 and 2024, about $14.1 million in total federal funds from pandemic stimulus legislation was available to fund water assistance to low-income households. However, Congress has not appropriated additional funding to that program, and there are not funds available in fiscal 2025. On the top of page 11, the other notable change I would point out is a $4.4 million increase in local administering agency administrative contracts for the cost to administer energy assistance benefits. These cost increases are funded through both a combination of LIHEAP federal funds as well as EUSP ratepayer surcharge funds. On page 12 of the analysis, there's some additional discussion of the EUSP ratepayer surcharge funds. In statute, there's a amount in statute mandated for collection annually is set at $37 million. The analysis is asking DHS to comment on the fact that the amounts budgeted in fiscal 2025 exceeds that annual amount. There is a provision in statute that allows for some carryover of unspent funds from the previous year, but DHS is asked to clarify exactly the source of the funds budgeted. Pages 13 through 17 of the analysis include some additional discussion on funds from the Strategic Energy Investment Fund budgeted for energy assistance. Under current statute, about 50% of state revenues achieved through the Regional Greenhouse Gas Initiative participation are budgeted to DHS for energy assistance. Exhibit number 7 on page 16 of the analysis shows a year-over-year comparison of those funds budgeted for energy assistance, reflective of the increased revenues that the state of Maryland has achieved through that program. You can see in 2023 and 2024 the growth in those revenues budgeted for energy assistance. And as I mentioned earlier, the amount of those revenues budgeted decreases by about $5 million to $94.1 million in fiscal 2025. At the bottom of pages 16 and 17 touch on the proposal that's included in the governor's budget to transfer about $90 million in fund balance from the SEEF to the dedicated purpose account to support implementation of the Climate Solutions Now Act and the Climate Pollution Reduction Plan. The reasons why this impacts DHS is that the Maryland Energy Administration indicated in prior testimony that about $8 million of that $90 million transfer could be sourced from the DHS Energy Assistance Subaccount. Exhibit 8 on page 17 shows estimates of the end-of-year CEF fund balance in fiscal 2024 and 25, and also reflecting that $90 million transfer. You can see on the top line of the chart under the DHS Energy Assistance subaccount balance, the fiscal 2025 end-of-year balance before the transfer is $13.8 million, decreasing to about $5.8 million following that transfer. There is a provision in the Budget Reconciliation and Financing Act authorizing the full $90 million transfer. DLS is recommending an alternate BRFA provision that would prohibit the sourcing of a portion of that $90 million from the Energy Assistance Subaccount and direct that the $90 million should be sourced from other areas of the CEF account. The issue section of the analysis begins on page 19 and includes some further discussion on energy assistance applications and benefit recipients. Exhibit 9, the top line, this chart is showing the top line, the year-over-year number of applications received, and the bottom 4 lines are the number of households receiving benefits for the 4 main programs. You can see the total number of energy assistance applicants has fluctuated in prior years, but in fiscal 2023 has increased by about 24%, reflective of high demand for energy assistance due to rising energy costs and other factors. The number of households receiving energy assistance benefits has increased in fiscal 2023, notable for the 2 bill payment assistance programs. Fiscal 2023 marks the first year where the number of household recipients actually increased year over year. Prior to fiscal 2023, the number had declined in each year since about fiscal 2014. Exhibit 10 on pages 20 and 21 shows additional data on energy assistance applications and benefits during the first half of fiscal 2024 in a year-over-year comparison to the first half of fiscal 2023. You can see at the bottom of page 20 that the total number of applications and households receiving benefits for all 4 programs has continued to grow through the first half of fiscal 2024. It's anticipated that this will continue to increase through the remainder of fiscal 2024 due to the impacts of the changes in categorical eligibility that went into effect on January 1st of this year. This is discussed further beginning on page 22 of the analysis. Chapter 207 of 2023, which went into effect on January 1st, amends the income eligibility criteria for the EUSP program and requires DHS to automatically enroll in energy assistance benefits households that have been found to be prior eligible for other DHS administered benefit programs. DHS also took action to amend the federal LIHEAP state plan amendment to align federally funded benefits with these changes. DHS was asked to commit in the 2023 Joint Chairman's Report to submit a report to the committees on this issue. In its report, DHS estimated that about 79,000 additional households could become newly eligible for benefits as a result of these changes. DHS also indicated that in fiscal 2024, it planned to take action to resize the average benefit size in order to account for these providing benefits to these newly eligible applicants within the available funding available. Exhibit 11 on page 24 shows a year-over-year comparison of the average benefit size for the bill payment assistance programs. You can see that in fiscal 2022 and 2023, the average benefit size has increased noticeably. The estimated percent of bill paid on this chart, as a result, reflects that increasing to about 95% in those 2 years. In fiscal 2024, the estimate percentage of bill paid decreases back down to about 80%, which is consistent with prior years prior to fiscal 2022. Exhibit 12 on page 26 shows data on application denial rates. The highest denial rates are for the 2 arrearage assistance programs. You can see those have had a little bit more fluctuation year over year for denial rates. The denial rate for the 2 bill payment assistance program was both about 20% in fiscal 2024 through November 1st and had declined by about 13% since the end of fiscal 2023. This is notable, as you can see on Exhibit 12, this denial rate of 20% is the lowest that it's been in recent fiscal years. On page 27, Exhibit 13 shows that the most common reason for application denial was due to an incomplete information in an application. The analysis notes that chapters 638 and 639 of 2021 made a change a couple of years ago, allowing for an additional 3-month period after an application was denied due to incomplete information for an applicant to provide subsequent information to cure that denied application. DHS reports that in fiscal 2023, about 16,700 such applications that were initially denied due to incomplete information were subsequently cured during that 3-month additional period. Exhibits 14 and 15 on the next pages show some data on application processing times. Exhibit 14 shows that the average number of days to process an application in fiscal 2023 statewide was 36 days. In fiscal 2024, it was 29 days through November 1st. However, there was some fluctuation across the local administering agencies. And there were about 5 local administering agencies that had average processing times of over 40 days. The analysis asked DHS to comment on some of the factors impacting those application processing times. And Exhibit 15 on pages 29 and 30 shows the percentage of applications processed beyond the 55-day guideline. Statewide in fiscal 2023, this percentage was about 22%. In fiscal 2024 through November 1st, it was 14%. Similar with the previous exhibit, the analysis asked DHS to comment on the reasons for some of these application processing times, specifically in Anne Arundel County, Prince George's County, Montgomery County, and the Southern Maryland Tri-County Action Committee, which had the highest percentage of applications processed beyond the 55-day guideline. The last item that's covered in the analysis on pages 30 and 31 is discussion of DHS plans to implement a centralized administrative model for energy assistance. Currently, energy assistance benefits are administered by a combination of local departments of social services, units of local government, and nonprofit community action agencies. DHS has previously indicated plans to transition to a centralized model under local Department of Social Services for these programs. In its Joint Chairman's Report response that was submitted to the budget committees at the end of 2023, DHS indicated that prior to this transition from occurring, there would need to be additional maintenance and upgrades to the MD Think system platform that would need to occur. DHS provided a timeline of that transition process occurring estimated in fiscal 2026. The analysis notes that that's approximately a 2-year delay from the timeline that was presented during last year's legislative session. I'd like to conclude my presentation by summarizing the DLS recommended actions, which are shown on pages 32 and 33. DLS is recommending 3 items of a committee narrative. The first would request a report on energy assistance application processing times and denial rates, similar to what has been provided in prior years. The second recommended action is to request narrative asking for a report on implementation of changes in eligibility for energy assistance, including asking for data on the number of households newly eligible in relation to the changes that went into effect on January 1st. The third recommended action is to request a report providing a status update on the establishment of the centralized administrative model and the timeline for that transition. That concludes my presentation. I can take any questions. Thank you.
There we go. Thank you so much. Committee, do we have any questions for DLS? Wonderful. Thank you so much, sir. Okay. So for the agency, we will call up again Secretary Lopez, Principal Deputy Secretary White, Acting CFO Resnick, and Director Catherine Nafagi?
No,
No.
just the
Okay.
three of us.
Yes, great. Just wanted to double check. Please, whenever you're ready.
It's still a good afternoon, Madam Vice Chairwoman and honorable members of the committee. For the record, I'm Rafael Lopez, and I serve as the Secretary of Human Services. You've already introduced our Principal Deputy Secretary and our Acting Chief Financial Officer. We thank the Governor and Department of Budget Management and everyone for their support, including all the folks who are here behind me to answer any questions if you have any. We'd like to bring your attention to speak about the Office of Home Energy Programs, which is housed within the Family Investment Administration. Specifically, OHEP administers energy assistance benefits through a network of local departments of social services, community action agencies, and local municipalities throughout the state of Maryland. Each year, OHEP provides services to over 100,000 Maryland households, many of whom are seniors, so that they can pay for utilities needed to stay warm during the winter months, prepare meals throughout the year, and power essential equipment such as oxygen tanks and other medical equipment. Today, we'd like to highlight two key areas for your attention. And first, obviously no surprise based on what Mr. Quist lifted up, the importance of customer service in our OHEP programs. Since our team took office last January, our administration has moved with great urgency around addressing what we have found to be long-standing and significant customer service issues with OHEP programs in all jurisdictions. Let me be clear, Marylanders who come to us seeking help to heat their homes deserve world-class customer service, and that's what we are intending to provide. Weekly and sometimes daily, we receive emails from Marylanders who are challenged in accessing this critical, oftentimes life-sustaining service offered by OHEP, and this is simply not okay. It takes too long to determine eligibility, and we have failed to leverage technology to accelerate services, especially when people are coming to us who might struggle with access to things like computers or mobile phones, etc. Our local administering agencies, or LAAs, have struggled to process OHEP applications fast enough, and we are taking a deep dive to better understand what are those patterns and practices across the state so we can be helpful. In some cases, it takes months before a customer receives a decision on an OHEP application, and that's just not acceptable to us. We are addressing the systemic customer service issues in this life-saving program. Over the past 9 months, we have set clear expectations with our LAA partners for case processing timeliness and customer service, and issued a new standard operating procedure to better identify and prioritize emergency applications for households at risk of experiencing a utility shutoff. We partnered with advocates to share brochures, flyers, and videos that help guide customers through the OHEP application process. In previous hearings, we've mentioned our partnership with Code for America, a nationwide leader in bringing human-centered design to government services. And together, we are making design improvements to the MD Think consumer website so Marylanders can get the help they need. In fact, we're piloting our project with Code for America next month in Baltimore and Queen Anne's counties. Using our pilot portal, customers will be able to apply for assistance as they would on MyMD Think, but under a simpler, more streamlined online application. We hope to learn very quickly by this pilot effort by engaging the very people who we serve more regularly, and including their voices in shaping how we put things on our portal, as well as engage our community organizations across the state and our local departments of social services. We will assess the effectiveness of this pilot project and look at basic things like application start to completion time. Where did people get stuck? What is the accuracy of the data submitted? So when we're asking for a particular document or a thing to verify, for example, one's income or something else, what are people interpreting the requests we make? How do we understand that more effectively? We want to know application drop versus completion rate. So when does someone get so frustrated they stop filling it out and they just walk away? How might we learn from those instances? Also, mobile device accessibility. While we do not expect people to have laptops, unfortunately, the original design of MD Think was around laptops versus mobile access and mobile-friendly applications. So we're already testing those things out, as many people across the state actually do have mobile devices. We'll refine the application throughout the pilot phase until we reach a point where we're more comfortable as a team with the final product based on customer feedback. We are listening to their voices as well as team members helping them fill out applications across the state. Our goal is to have a mobile-first application that a customer can start and complete in under 20 minutes. We've never done this before at DHS, and we must push ourselves to try new things to better respond to the people we serve. This year, our team will strengthen our customer service practices, accessibility, and language requirements into all future-facing LAA contracts. As we reviewed these contracts in this past year, we learned that there was absent, not just in these contracts, but in so many at DHS, very specific metrics to hold ourselves and our partners accountable. And partnerships are about that, holding each other accountable for the results we intend to serve the people of Maryland. In fact, our Principal Deputy Secretary and I have personally pledged to visit every single OHEP office in the state, and though we've visited every jurisdiction in the state multiple times, we're zeroing in on things like OHEP to learn firsthand what those challenges are, both with our contractors, providers, and vendors and community organizations, as well as our team members and people we serve. In fact, next week on the 11th of March is one of those first visits that we kick off in Prince George's County as we do the statewide tour to better understand how to quickly integrate what we're hearing and turn it into action-oriented steps. We'll streamline how Marylanders access the help they need by modernizing both MD-Think as well as our engagement as government team members to make sure we're responsive to what we hear. In all this work, we will lead by courage, not by fear, in terms of what we find, and taking a responsibility and accountability for continuous quality improvement. So we look forward to updating you all by next year on the significant changes we continue to make in this program. The second item we'd like to bring up to you is programmatic changes. And there are some specific ones that we'd like to respond to on the record regarding recent legislation passed by the General Assembly, for which we're grateful. So last April 2023, the Maryland Public Service Commission ended the extended utility payment plans that were in place since the beginning of the COVID-19 pandemic. Expiration of these payment plans is driving a 24% year-over-year increase in applications for energy assistance as households struggle to cover utility expenses accumulated during the pandemic. 2023 had 149,196 applications, which is the highest number of applications on record received since 2019. Effective October 1st of last year, we adjusted the income threshold for the Maryland Energy Assistance Program, or MEAP as it is known, to 60% of Maryland's state median income, which, by the way, is $81,864 for a family of four. With this policy change, more households qualify for energy assistance. Last year, many working households earning $50,000 for a household of four did not qualify for energy assistance benefits. So you can see just within the last couple of months that increase in the eligibility of Marylanders, and therefore they're reaching out to us for help. These households now qualify under the new adjusted income thresholds, and households with earned income benefited most from this policy change. DHS also successfully implemented HB 323, which passed during the 2023 legislative session. The law required our department to automatically enroll SNAP and TCA households in energy assistance programs. In the month of January 2024 alone, 9,300 customers were automatically enrolled in OHEP programs. We will continue to monitor this work to better understand where we have to adjust, where we have to strengthen our progress, and how we can be even more responsive to Marylanders to make the system work more seamlessly for them. While we have made some progress in this last year streamlining access to OHEP programs, we have a ton more work to do. We will continue to act with urgency to improve customer service and make applying for and receiving these critical services much more simple, seamless, and swift. And as I mentioned previously, OHEP is a division or a part of the larger Family Investment Administration team. It has historically and heretofore been treated as a separate piece of DHS. It is not. It is absolutely integrated into the Family Investment Administration, and we should treat the program itself, the funds, and the way in which we engage Marylanders as one team across the Department of Human Services. That said, for next year, we respectfully request of the committee's leadership and of the legislature that we take up our hearing as part of the Family Investment Administration's budget hearing. We don't think we need to separate out OHEP in terms of the work, and certainly not the people we serve. It's the very same families who struggle across the state of Maryland who are served by OHEP. So this budget proposal was assembled in partnership with many of you. We're grateful for your partnership, and now I'll turn it over to our Acting Chief Financial Officer, Cheryl Resnick, who will walk us through the responses to the DLS analysis.
There we go. Thank you. Thank you, Mr. Secretary. Thank you to the subcommittee members. I will be responding to the questions posed in the analysis. Again, I will be providing a summary of those responses. Please refer to our submitted testimony, written testimony for the full answer. To question number one, asking us as to the reason for the decrease in participation among households with members over the age of 60. There was an overall decrease in the percentage of households with members over 60 and households with individuals with a disability because there was an overall increase of about 20,000 in the total number of households participating in OHIP programs between fiscal 22 and fiscal 23. The number of participating households increased due to a recent change in federal income guidelines for the Maryland Energy Assistance Program, or MEAP, that became effective October 1st, 2023. In your testimony is a chart that shows how many the MEAP income thresholds for the different household sizes before and after October 1st, 2023, to give you an idea of what those changes look like. To question number two, asking us to comment on why the total amount of these funds budgeted for fiscal 25 exceeded the statutory annual collection amount. This appears to be a mistake in the department's budget submission for FY 2025. The department does not intend to exceed the statutory allocation of $37 million for EUSP funds collected from ratepayers. As in previous years, the department intends to utilize roughly $4.9 million of that money for administration of the program, $200,000 for statewide outreach activities, $1 million for OHIP data management systems, and the remaining $30.7 million for EUSP benefits pending approval by the General Assembly and the Public Service Commission. To question three, asking us to comment on the reasons for the increase in average days to process applications for the Southern Maryland Tri-County Action Committee, and in converse, the decreases within Allegheny, Prince George's, and Washington counties. The FY24 data shows an overall decrease in statewide average processing times from 36 days to 29 days. However, with regard to the Southern Maryland Tri-County Community Action Committee, shifts in application processing times are attributed to both the increase in applications as well as some of the many staffing challenges that we have been facing that you are all aware of. Contrary, the decrease in application times in Allegheny, Prince George's, and Washington counties are attributed to both business process changes, filling vacant positions, adding additional staff support, and focusing on clearing backlog applications. We continue to work with our local administrating agencies to improve business processes, take some of the lessons learned in the counties where we have decreased time, and apply it to places where time has increased, such as Southern Maryland. To question four, asking us to comment on the reasons for the high percentage of application processing beyond 55 days for the Anne Arundel County, Prince George's, Montgomery County, and Southern Maryland offices. And we do acknowledge that 55 days to process an application is too long. We're working to identify business processes with our LAAs to decrease application processing times. The major contributing factor to the increase in application processing times is an increase in the number of applications being received due to the change in the income guidelines of October 23, as referred to earlier. Finally, to question five, asking to recommend adopting committee narrative, requesting a report on the status of transitions. DHS concurs with the recommendation and happy to provide the report. With regard to the three DLS actions recommending budget narrative, to recommendation 1 and 3, DHS concurs with the recommendation. We're happy to provide the report. To recommendation 2, we also concur with that recommendation and will provide the report. However, we do respectfully request a due date change to February 1st, 2025 to account for capturing of all the reporting period. With that, I'd like to thank the committee for their time, answer any questions, and ask you to support the governor's allowance.
Thank you so very much. And I have one quick question before I turn to my colleague from Western Maryland. Just for the record, when was MD Think rolled out, and when did that begin? You spoke earlier in your testimony regarding the design did not include the ability, like, for mobile devices. It was really only for desktops and laptops. Do we know the date that MD Think was rolled out?
I do, and I want to make sure I don't misspeak because I have it in my head, but I think I'm off by a year. I want to say it's 2017 or 18. Give me 1 second, I have it here.
I believe the date for, so MD Think, the platform has many applications on it. So the FIA application was rolled out in 2021. So that's when it was implemented in 2020. The E&E application was implemented in 2021, December of 2021.
So I want to add to that, only because I wasn't here when that was rolled out. Thank you very much. But I will say my colleague to my right here was the director of Anne Arundel County. 2021 was only a few years ago, and the notion of building things, I know, the notion of building things mobile friendly was not a new concept in the United States of America, much less the world. So unfortunately, it was...
It wasn't back as far as you thought.
I know. I was like, I think because ultimately, I think you were asking, like, why would the state have built it to not be mobile friendly, which is the way I interpreted the question?
Well, yes. And yes, I am. You are interpreting correctly. As personally,
right.
I had a firm. It was a national firm. Right. In 2009, our website went live, and it had a mobile design, and it had a laptop design.
Exactly.
And so I'm also old enough to remember being a named partner in that firm in 2009, that rollout. And just to, we have folks especially using OHEP and using all of MD Think, frankly, that it's outrageous to think that everyone has a laptop at home. And so to jump, the shark, my 77-year-old father from Western Maryland, a constituent of Mr. Heinball's, who also served they served together, Army and Vietnam, he even tells me who has an app and where to go. So, so this is something that has been around for quite a while. So I just wanted everyone to be on the same page.
We appreciate it very much. And I will say that when we lifted up the Code for America example, the good news is that in partnership with community advocates and LAAs and LDSSs and all the other acronyms, we are trying to figure out how to be more responsive quicker, which is why we're going to learn very quickly, testing that pilot out in 2 counties, and actually asking our customers, how easy was it? How hard was it? And only designing it through mobile friendly. Because we know that even, for example, my colleague Kevin Lindemood, who's the head of Healthcare for the Homeless, most of the people that come to Healthcare for the Homeless for services are using their mobile devices to access very complicated, very labor-intensive ways of proving their income or not. So using other examples and other partners across the state to learn this, including, for example, issues of rural communities not having the same kinds of access, or our seniors who might not have quick availability. So really partnering with our advocacy community and partnering with people who are filling out applications on customers' behalf, trying these new things out in a mobile-friendly way.
I appreciate that in a socio-demographic way, the equity involved in this, right? Our libraries are reporting that people may not be able to pay their phone bills. They still have their smartphones, and they're coming to use the library for those services so they can log on. So thank you so much, Secretary. Mr. Heinball.
Thank you, Madam Vice Chair. I had something to say about being old and a Vietnam vet and apps, but I'm going to skip that for now. So
you did turn red, sir.
Thank you for being here. And obviously, what I want to talk about is Home Energy Assistance Program. We talked about this last year. Even though, I don't know if you remember.
I do.
In my district, which is Garrett and Allegheny County, that's a very, very important program. In my observation, it's one of the few government programs that actually is very effective at getting the money, the funds, the resources to the people that need it. And it seems to have operated very effectively in that the vast majority of the money actually goes into the program and not the administration. I'm a little concerned because if I'm reading this properly on page 11, and maybe I'm reading this wrong, but it sounds like because of the loss of funding from the Infrastructure and Investment Jobs Act, that there's going to be less money to go into the energy assistance program. If I'm reading it correctly, it's like a $10 million less. And I guess that concerns me in itself. And my basic question is there going to be a way to backfill that or replace that, especially as we look ahead? And then the second part of my question, at the same time the funding for the program went down, the administrative costs went up. And I've always been very proud of this because the administrative costs were so low. And I'm just curious about why that went up. And I'm a little disappointed you didn't cite Allegheny and Garrett County for their processing times of 2 days and 7 days or whatever it is. But
it is not too late to do so, sir. So on behalf of the Department of Human Services, we are deeply grateful to the counties of Allegheny and Garrett for modeling statewide efficiency.
Thank you, sir.
There you go. So for those watching on television from Allegheny and Garrett, hello, we've got your back. Now, that said, you're not going to like my honest answer about the first part of your question, which is that as the nation recovers from significant COVID-era federal funding, most states are not able to backfill immediately the significant federal dollars. So I just want to say that out loud. It's the honest answer. There are many examples, not just in our department, across the entire state of Maryland, where we were flush with cash that was time limited, and the choice was made at the federal level with our national representatives to not continue sending that funding. That's not a blame issue. It's just a matter of how the priority was made. That said, you said the second part of our conundrum, which is just as we are declining or tapering off federal funding for some of these programs, there is now a change in the eligibility requirements in a good way to allow more families to be eligible at the time where we have less money. So one of the things we're trying to take a look at is how can we be as fair and equitable as possible? How can we make sure that it's easier to access it so that we can get money out the door faster? Also, the use of technology isn't just an MD Think issue alone. DHS has struggled historically with trying to streamline how our local departments, as well as our local agencies and our community-based organizations, use technology to process things faster. Why? So that the time the staff are taking is not about processing paper, but about actually engaging with the human about how might I support you? Might you know that, Mr. Heimbach, you can actually go and get this support here or this support there, and really doing the work of human services versus processing paper and timelines. So that's another lift for us. The final piece is around, do we have today an additional source of income or revenue to replace those funds? And the answer for Maryland right now is no. Again, not probably a disappointing response, but I want to just say very clearly on the record the reasons behind it, that we're doing our best to be as fair and equitable, and that we will continue to be as innovative as possible and look to other ways to draw down both innovative federal grants or other opportunities to help strengthen our energy assistance program here in Maryland.
Is it possible that shortfall could be filled in the future from the general fund then, if it was budgeted?
The quick answer.
Delegate, you have the right to do anything you would like with state general funds. Absolutely, we've seen countless examples during this session of places where additional general fund revenue could bolster our program and bolster the benefits that we provide. But at the end of the day, this is always a question of balance and how you meet your obligations to the state budget.
Understand. Thank you.
One piece I realized I didn't answer, but it's worthy of mentioning on the record, because it's about what I've heard statewide from particularly our local Department of Social Services directors. So very specifically, the name Courtney and Lisa in your district, but others share this as well, which is that for many, many years, DHS has systematically under-budgeted how we fund them from the state to the local to actually staff up these programs. these things don't staff themselves. They're humans who live in your county who actually help people get help they need, right? And that is a cost. And one of the things we've done in preparing this budget, which is, as you can see, a change, is being much more thoughtful and responsive to local leadership. We are still recovering, and we will for the next couple of years, on things that weren't budgeted. I mean, flat out, we could not find them in the budget anywhere. That cost, many of them staff, things like overhead, rental agreements, lease agreements. So we are still a few years out from catching all of that and trying to be fiscally responsible, both to the governor's budget and to all of you, members of the General Assembly, to try to balance these competing needs. So I hear you loud and clear on the low ratio of administrative costs. That is true. We want to keep it down. We also want to be thoughtful that these programs just don't run themselves. And that's why things like efficiency and use of technology to process applications matter to all of us. It's not just spending on some new fancy computer piece. It's actually figuring out how to make sure our people can spend the time helping customers and get the resources they need.
Thank you. So I think what you said is there's going to be less money and more people who are eligible. So
That's correct.
Per capita distribution is potentially going to be much less than it has been in the past.
That's correct, at least for the several years during the COVID pandemic, which had an influx of cash, not just here in Maryland, but across the country.
No, thank you for your
Certainly.
candid answer.
Certainly.
Thank you, ma'am.
Excellent. Thank you, Delegate Heinbaugh. Energy assistance applications, if maybe I could just take you to page 20. Exhibit 10. It shows significant increases in both applications and those receiving benefits. Could you comment on how many applications are duplicates? So applications that individuals started and then abandoned before later restarting a new application. Is that what we're seeing in this?
So here's what I recall from the conversations, and again, it won't surprise you that say this. The question of unduplicated counts, and so an unduplicated count would be Ms. Jones applies for X service, and then she applies again tomorrow. Are you counted twice? Or are you counted as once because we can tell that it's Ms. Jones?
Right.
The integrity of the data is something that we aren't 100% certain of. And so why that matters is because we'd like to come back to you with trying to tease out the duplicated counts or unduplicated counts to have a stronger response for you. Happy to do that as a follow-up.
That would be great.
Sure.
Because when I look at it, I'm thinking, okay, is this starting the process, getting through it? It takes me a little bit longer. The kids come off the bus.
Yep.
And I have to get to it again tomorrow, and so I restart the process,
Understood.
right?
That's exactly right. So we had said during the testimony, because this is an example, we are trying to get the prototype to be start to finish in an application under 20 minutes. If we can do that, that's our goal, right? And then in this summer, it will dramatically change how long it takes anybody. So the word we hope will spread, and we will actively do that actually applying for OHEP is much easier to do. That way, a busy mom, a busy person, can actually quickly try to get to it. So that way when they come back to it, we can very clearly identify whether or not it's the same person or not.
But in addition to that, there has been an increase in our applications overall, as we testified to. And there's a couple of reasons for that. One is the median income has increased, and therefore more people are now eligible. So the applications has been increased. And then there's also a change there's the automatic enrollment of the law that was passed last year that has also increased the number of applications that we've had for energy assistance. So we are seeing a significant increase in applications. The duplication piece will come back and have more detail about that, but I just want to say that there has been an increase in applications overall.
I'm so glad you mentioned that, Principal Deputy Secretary, because I wanted to lift up a number to sort of concretize your question and the response as well. So in January 2024 of this year, we had 9,300 customers who are either SNAP or TCA households automatically enrolled. That's in 1 month.
What's that number again? I'm sorry.
9,300.
Thank you.
That number we know for sure. And those are unduplicated.
Right.
Unduplicated, right. And so that's why teasing out these numbers matters so much, that we can quickly extract and find out what are those patterns, where are they, in what counties, where are we seeing the largest increases, et cetera.
And when will we be able to drill down or tease those out? When do we think we're going to know that info?
We can get overall response by the end of the week, I'm hearing.
That's tremendous. I can't wait to read that. Thank you. Does OHEB require any changes in statute to provide the office the authority to require contracts with local agencies like average wait time in waiting rooms, active voicemail and voicemail response time? Is there anything that we should know about?
The quick answer is no. The appropriate answer is those should have been built into the contracts, and they're not from our review of them. So that's where we're heading moving forward in future contracts between the Department of Human Services and anyone who chooses to partner with us to provide these services statewide.
Okay, thank you. Application denial curing. So on page 27, the DLS analysis notes that FY23, nearly 17,000 applications initially denied were able to be cured. Can you extrapolate on this process and how it works for a customer and the LAA?
So what happened, and if Augustine can help me if I misinterpret how the practice is now. So there's a 90-day cure period that has been implemented. So now one of the major reasons why people's applications were denied was because of verification information. And so now we're able to hold the application open for 90 days. And if persons submit their verification within those 90 days, then we are able to go back and approve that application from the date in which it was applied. So if I applied on January 1st and I didn't submit my verification information for 90 days, the application goes back to the January 1st date, not from the date that the verification was submitted. So while we've seen, and what has happened is we've seen a decrease in the number of denials. We're seeing a decrease in the number of denials, but you'll see that the information on how long it's taking us to process applications have increased. And so what we're doing is also working to tease out that those applications that had to be reopened from the date after from that 90-day period, so that we have a better understanding of what is causing the length of time for application processing.
So are there requirements for the local, for the LAAs in going over the denials and curing them? And do they have requirements, or is
Yes, that's part of the work that they do. The LAAs are the ones who actually do the applications and cure them when the information comes in.
And so is there data similar to the jurisdictional breakdown of processing times? Like if some jurisdictions were more effective than others in curing these problems, do we have any breakdown?
I can go back and check. I don't know if I have that information. I don't know that information off the top of my head, but we can go back and.
Okay, thank you so much. And let me turn it over. Deli, oh, no. Let me also ask. So benefit size and payments. During the recent fiscal years, we've seen a significant one in average benefit and swings in the average bill payment. As the impacts of categorical eligibility are taken on by programs, can you comment on the strategy efforts to the extent possible? So we're limiting swings and steady expectations for Marylanders in need. Is there ability for you to kind of drill down on some of that? It's mainly, I have it listed in my notes on Exhibit 11, page 24.
Yeah, so I think there are a couple of things. As we've testified, we've seen an increase in applications, so there's an increase in need, but the pot of dollars that we have has not increased.
Right.
And so we have to balance that out on the amount of benefit that we can give out per customer in order to serve more persons, but with not as much money per person. And so we're working through that to figure out what that equitably looks like. so people can understand what their benefit amount will look like. We also work in partnership with many community organizations, and so oftentimes a person may get a benefit from us, but in their own jurisdiction, there are other funds that they also get to kind of help supplement as well. So we're trying to make sure that we're able to serve as many people as we can with the amount of dollars that we have, and that does mean that there will be a decrease in the benefit amount.
Thank you. Delegate McCaskill.
Thank you, Madam Vice Chair. I apologize for earlier. So I am going to page 24, and I am at Exhibit 11 as well, and I have a really quick question. And so Exhibit 11 describes the changes in estimated bill and an estimated bill paid percentage at the highest level of need. Can you describe how this same reduction is felt on the 4 additional tiers of eligibility?
So if I understand your question correctly, and I could be wrong, so please correct me if I am, from what we've seen in this last year alone to Delegate Heinbaugh's question, we're seeing patterns across all of our programs. Okay. So increase in the need for help, decrease in total amount of revenue to compensate customers who are asking for help, and to our Principal Deputy Secretary's point, the need to be as fair and equitable to give some help to more people. We are going to have to take a look at that. So whether it's specifically on, say, gas or electricity, we're finding these patterns. Now, I will say that when we take a look at what's happening across the country, Maryland is not an outlier in terms of the need. What we might be an outlier still on is our use of things like technology to process and respond more quickly so that we can be even more efficient in the help we do provide.
Okay.
So I will say that, and what we could do is take a closer look to make sure that there aren't any standouts of the kinds of program support we're giving, and we're happy to respond to that, because that we would know. I just don't have it at the top of my head.
That's perfect.
Certainly.
Thank you, Madam Vice Chair.
Thank you. Any other questions from committee members? Great. Well, thank you so very much. I appreciate you greatly. And we do have 2 public witnesses that are signed up. We have Ms. Cindy Carter from the Cancer Support Foundation. I don't see her. And also Ms. Laurel Peltier, Maryland Energy Advocates Coalition. Okay, I don't think either of them are here. I believe they have some testimony in our floor system committee members, so if you would please refer to their written testimony. And with that, we will adjourn. Thank you so very much.